This was just a descriptive narrative thing. I don't necessarily need to spend a lot of time in this, but the University of Buffalo developed their own kind of concussion evaluation, tool, just a standardized way of assessing a concussion. And they jigged it for telehealth. All right. And so we've included the telehealth. We've loaded it onto the resource portal. And so you guys can have access to that and see if you want to use it. It's fine. It's in a Word document, so you can download it. You can use it. I think it's just the Buffalo Concussion Telehealth Examination or something like that. But basically their physical examination, because over telehealth, it's difficult. So they've devised ways of doing this. And here's what they include in their physical examination. So orthostatic intolerance. Okay, so standing up, not being able to tolerate going from supine to standing. And you can kind of read through this stuff, but here's the test that they do. They do 2 minutes of supine, right? And it's just tick box. Do you have any symptoms? No, click. Or do you feel lightheaded? Do you have vertigo? Or do you have any other symptoms when you're lying down? Then you do 1 minute of standing, right? Do you feel lightheaded? Do you have vertigo? Do you have any other symptoms? If no symptoms, you just check that. Okay. So that's how they do it. So they have a patient at home lie down for 2 minutes, ask them some questions, have them stand up, right? So they're not obviously able to measure blood pressure or heart rate during this. I mean, if somebody had a heart rate monitor, they could theoretically do it. But for the most part, they're just, talking to people over online. Cranial nerve screening. Here's how they do it. They don't do things like, sense of smell, for example, because they have no way of really, doing it. So here's how they do kind of an abbreviated cranial nerve exam. And obviously, when cranial nerves are impaired, it's more likely you're going to have multiple impairments. So, missing one is not necessarily that big of a deal, because if there is an impairment, you're likely to overlap with other ones too. Cervical spine exam, you can see here kind of what they do. So we've included all this. The paper is also there too. If you want to take a look through, you can read all this stuff of just how they, what types of things they look for. They have the patient do some self-palpation as well. Okay, probably not the greatest, obviously, especially because, you have a physician guiding a patient on how to feel their neck. I don't think either one is necessarily all that qualified when it comes to assessing tissues and things like that. So it's not going to be the best, but it gives you something. They have range of motion, right? Are they able to flex their neck to 50 degrees? Are they able to right laterally flex and right rotation and all this stuff? Okay. And then they do a flexion rotation test as well, which is interesting. Ocular motor examination. So they have them basically do somewhat of a VOMS, right? Smooth pursuits. They do 10 repetitions. They have them track the finger or their own finger, repetitive saccades and VOR testing, 10 repetitions, horizontal and vertical. And they have their check boxes here. Vestibular examination. They include the near point break, finger to nose test. And then they do some Rombergs and some balance type stuff, single leg stance, etc. So you can take a look at that. And away you go. So there's no real, there's no validity to this necessarily. It's just, here's what we do and we've published it. So you guys can feel free to use it type of thing. So we've put it there for you. If you want to try it out, give it a go.